Meet 20-year-old Ethan Lindenberger of Ohio. Ethan wasn't vaccinated as a child because his parents were vaccine hesitant. He began challenging his parents' views at age 13 and started pursuing vaccination around age 16. However, Ohio state law requires parental consent for vaccinations, and he had to wait until his 18th birthday. He was terrified of contracting vaccine-preventable diseases, but he had no choice. Ethan has now caught up on his vaccines, but he is helpless when it comes to his unvaccinated 4 younger siblings, including a 16-year-old brother who wants to be vaccinated. They, too, must wait to turn 18. Vaccines are one of the biggest success stories of modern medicine. The Centers for Disease Control and Prevention estimate that vaccinations will prevent more than 419 million illnesses, 26.8 million hospitalizations, and 936,000 deaths among children born in the last 20 years in the United States alone. And globally, immunizations prevent an estimated 2 to 3 million deaths every year. Despite overwhelming evidence that vaccines are safe and effective, vaccine hesitancy is rising nationwide. In 2019, the World Health Organization listed vaccine hesitancy as one of the 10 leading threats to global health, and over the past decade, the number of philosophical exemptions to vaccination has increased in 2/3 of the states that allow such exemptions. As a result, the United States has seen declining vaccination rates and resurgences of diseases like measles that had been nearly eliminated in this country. Like Ethan, there are some minors who weren't vaccinated as children, but as they've grown older, they've learned that vaccines are safe and effective, and they wanted to become vaccinated themselves. Although minors aren't mature enough to make some decisions, they are mature enough to make others. All states already allow minors to make some healthcare decisions without parental consent. These generally include decisions about sexual and reproductive health, mental health, and drug addiction, and at least 18 states in the District of Columbia already allow minors to consent to some or all vaccinations without parental permission. However, between judicial decisions, legislation, and accepted practices, there's significant variation about what vaccines minors can consent to, if any. Furthermore, vaccines aren't often explicitly mentioned in legislation or judicial decisions, making it additionally complicated for individuals to determine if their state allows them to self-consent. Please consider introducing federal legislation allowing minors age 14 and older to consent to vaccinations without parental permission. Vaccines are one of the safest medical interventions available, and at a certain age, minors are capable of understanding the risks and benefits of vaccination. Older minors want and deserve to have bodily autonomy when it comes to immunizations. Ethan Lindenberger had to wait to turn 18, forcing him to live in fear while his life and the lives of others were at risk. The lack of federal legislation means that children like Ethan are at risk of suffering and helpless to do anything about it. Introducing this legislation will empower minors to protect themselves and their communities, saving lives.